Thank you, Mr. Chairman. Mr. Chairman, this past July, Aetna announced its intent to merge with Humana, and Anthem similarly proposed to merge with Cigna. These firms represent 4 of the 5 largest for-profit health insurance companies in the country. Currently, the Department of Justice is reviewing the deals. Its review will involve a detailed, fact-specific analysis that will likely take more than a year to complete. Unless the Department of Justice seeks to enjoin one or both of the transactions, nearly the entire antitrust review process will take place outside the public view. In contrast, today we have before us the 2 CEOs of the acquiring companies who will state their cases for the mergers. They sit at the same table as some of the most vocal critics of the deals, and each will have an opportunity to respond to our questions about their views and the impacts of the prospective transactions. Through this record, the public will better understand the asserted merits and concerns regarding the proposed mergers. Furthermore, the record created today will assist the committee in administering its oversight of the antitrust enforcement agencies. Lurking behind the antitrust review of these deals is the question of how much influence Obamacare had on the proposed transactions. This issue is of keen interest to the committee, and we have conducted several hearings on the broader issue of Obamacare and its impacts on consolidation and competition in the healthcare industry. Certainly, the Affordable Care Act has had a profound effect on the health insurance industry. The law greatly diminished the flexibility of insurance companies to manage the risks of insuring patients. Coupled with these rigid parameters are requirements on how insurance companies can allocate funds for medical claims and other expenses. In many respects, health insurance under the Affordable Care Act resembles more of a commodity than the nuanced and diverse product base that existed prior to the law's enactment. Many commentators speculated that these constraints, together with the significant regulatory burden placed on insurers, would cause greater consolidation in the industry. The Affordable Care Act put into place incentives for insurers to increase in size so they can better manage costs and the heavy regulatory burden and operational constraints imposed by the law. Indeed, at our most recent hearing focused on consolidation in the healthcare industry, we heard testimony that insurers are leaving the market, insurance policy coverage is narrowing, and consumers are ending up paying more for less. These are hardly the results that the Obamacare proponents promised. In addition to learning about the specifics of the proposed mergers and the concerns raised by critics of the deals, I look forward to hearing about the role the Affordable Care Act played in these mergers and in the insurance market generally. Thank you, Mr. Chairman, for continuing the committee's series of hearings on competition in the healthcare industry. I look forward to today's discussion on the pending health insurance mergers, and I yield back.